Hi, my name is Jose Miranda Velasquez. This video is for BSN 225-21. This video is the administration of subcutaneous injection. I'm in my Nightingale scrubs, and as you can see, I'm wearing my badge. Wanted to point out that I'm using my phone and a tripod to record. To start off, I'll be gathering my supplies. First, I have the medication vial, a pair of gloves, gauze, alcohol wipes, and the syringe and needle. That comes with the needle. I want to point out that we are using a 1 milliliter syringe. This is a 1 milliliter, 25 gauge, 5x8 syringe. It's just the supplies that were sent to me in the box. Moving forward, now that I have that information out, I will verify the 6 rights of patient administration. They are the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. After, I do need to check the verification. I need to check the medication and verify that with the EHR. This is the first step in the verification process of the medication with the MAR. I need to check that 3 different times before I can administer any medication to the patient. This is 1 out of the 3. The order reads for heparin injection, 1 dose of 1,000 units. For my calculations using dimensional analysis, I have written down here on the post-it note. There's nothing on the back. The calculation reads 10 milliliters per 10,000 units, and I will multiply that by 1,000 units, which will equal to 1 milliliter. Therefore, my patient will be receiving 1 milliliter of heparin. My supplies are ready to go. So I've gathered my things and head towards the patient's room. I'd knock, enter, close the door behind me to ensure patient privacy and to avoid any HIPAA violations. Set my supplies down on a clean, dry, flat surface and perform hand hygiene. Introduce myself to the patient. Hello, my name is Jose. I'm a nurse here. Can I have you state your name, date of birth, and medical record number if you know it? I would check those with the patient's wristband, as I do need to verify the 2 patient identifiers. Thank you, Mr. Miranda. Are you allergic to anything that we're not aware of? Nope. Thank you. Now that I verified the patient information, I'm going to check that medication again with the MAR. In doing so, this would be the 2nd time checking it. Mr. Miranda, as you can tell, I have some stuff here for an injection. Your doctor ordered a heparin injection. I want to talk about the mechanism of action for this medication. This is an anticoagulant, and it prevents thrombin and fibrin formation, which therefore prevents blood clots to form. Some common uses for this medication are that it is commonly given when someone's going through surgery through an IV, or in your circumstance for your DVTs that you are experiencing. There are some common side effects that go with the medication. All these are common side effects, and if they do prolong, this could be cause for concern. So if this has happened, let me know. These side effects, it could include bruising, extended amounts of time to clot if you were to get a cut, or even after the injection site. After a while, you could see some discoloration, which might be bruising. If you notice any of these, or any of this gets worse, please do let me know immediately. So adverse reactions, first and foremost, we don't want them to happen, but if they do, please do let me know, as they do require immediate medical attention. And I would come and do an assessment and notify the doctor immediately. This could be severe abdominal pain, blood in your stool, blood in your urine, or in the cough. So if you're seeing blood, please do let me know immediately. Also, I wanted to point out, upon administering the medication, you might feel some slight stinging or burning sensation. This is normal. Any questions for me? Nope. Perfect. Okay, at this point, I would go and verify the medication with the MAR. This would be my 3rd time in the verification process with the MAR. Okay, so I need to make sure that we are okay. A tripod. Make a tripod adjustment here. Okay, once I'm done verifying with the MAR, I will perform hand hygiene and don my gloves and prepare the medication. I want to clean the top of the medication vial with alcohol pad and dispose of it once I'm done. Okay. As the top of the vial dries, I want to draw up the appropriate amount of air into the syringe. In this case, it's 1 milliliter. I'm going to open that. Take my syringe. It's a 1 milliliter syringe, so I'm going to draw the whole thing of air. As you can tell, it's 1 milliliter. I'm going to hold it like a pencil, needle up with the cap on. And I want to draw the air into the syringe. Okay. Like a pencil, cap still on, 1 milliliter of air. Next, using my 2 fingers, I'm going to remove, and I mean these 2 fingers, I'm going to remove the cap and inject that into the medication vial, administering the air into the vial. Air is in the vial, and I will invert the vial and begin drawing the solution of 1 milliliter. I have my 1 milliliter. I want to gently tap on the syringe to get rid of any of the bubbles. If I need to, I can push the medication all the way back into the vial. Gently push at the edge of the plunger and bring it right back out to 1 milliliter to get rid of the bubbles and stuff if need be. For this case, there are no bubbles. I will bring it over for you to see in a moment. We'll pull that out, and using my soup method, I will go ahead and soup the lid back on and place my cap back on for safety. As you can see, I have 1 milliliter of medication. I just finished capping my needle. I have the medication ready. 1 milliliter. I'm showing it here to the camera. Okay, I'll put that aside. Now that this is done, I can go select the injection site for the subcutaneous injection. There are 3 places they can go. They can go in the upper arm, in the thigh, or the abdomen. In this case, my patient wants this injection in the abdomen. Ideally, if we go to the umbilicus, right in the middle, we can use that as the margin. You have the left and the right of the umbilicus to go. So I will go ahead and use this. So this is the umbilicus right in the middle. We have the left, we have the right. I'm selecting the appropriate site. So once I have selected it, I'm going to assess the site for any complications such as bruising, inflammation, edema, or any signs of infection. If such are visible, I need to choose another site. I want to gently palpate the area, make sure there's no masses or any tenderness. So this site is appropriate for use. I want to pinch the skin and get the needle and make sure the needle is going to use it as a measurement from the top of the skin fold to the bottom. I need to ensure the needle measures half of that. In this case, it does. Moving forward, I'm going to grab the alcohol pad and I'm going to clean and wipe the site, starting at the center, working my way out 2 inches, and then I will dispose of the alcohol pad. Trash. Now that the site is clean, I want to make sure I don't touch anything in the middle. I want to make sure it dries. The site is ready for injection. When I'm injecting, I want to make sure that the thumb and the index finger, I want to use those to hold the syringe, and then use the other hand to remove the cap, like so. So my skin is dry. I'm going to remove my cap. My needle is exposed. So from here, I will go ahead and I'm going to pinch the skin to create a skin fold. Then quickly inject the needle into the skin at a 45 to 90 degree angle. And I'm going to use the palm of my, I'm just going to dart it into the skin using my palm. Hold on the skin and go ahead and inject. I'm going to release the skin fold at the bottom and then use my non-dominant hand to hold the syringe while I push the medication with my dominant hand. I'm going to inject the medication slowly into the patient's abdomen for 30 seconds. I don't want to slam it. I want to push it over 30 seconds. Okay, medication's in. We'll go ahead and remove my syringe. I'm going to take my gauze. I don't want to really move the syringe a whole lot. And we'll go ahead and pull that out and place my gauze on there. Apply some pressure if I need to. I will go ahead and quickly put my safety on and discard my needle into my sharps container. So that's disposed of. I will look at my injection site. I don't want to rub, massage the area. I simply want to place the gauze on it in case there's bleeding. Excuse me. In this case, there's no bleeding, so there's no need for a Band-Aid. No blood. Once I'm done, I would gather my supplies. I want to check on Mr. Miranda. Ask him, Mr. Miranda, are you comfortable? Okay. I can go ahead and finish gathering my supplies. Make Mr. Miranda comfortable, if need be. I will go ahead and ensure that the call light is at bedside. Make sure that the bed is in appropriate position for comfort. I would go ahead and finish cleaning up. Throw everything away in the trash. Dispose of my gloves. Take them off. Take that with me. Put it away. Perform hand hygiene. Exit the room and then go ahead and go document my results. All right. Thank you so much.